So many options in 2025 when it comes to helping you look and feel your best, including fat grafting and fillers. But which option is right for you?
So joining us now in the sponsored segment, two trusted professionals from Utah Facial Plastics, double board certified facial plastic surgeon Dr. Scott Thompson, along with aesthetic injector and master esthetician Sarah Olsen. Thank you both for being here.
Thank you for having us.
We're so happy to be here.
The creme de la creme of professionals in Utah plastic surgeon and also injections as well. So let's talk about the two differences with grafting and fillers.
Yeah, so both filler and fat are intended to add volume to the face. We lose volume as we age. The face we know it falls, but it also loses volume. And so filler and fat are different ways to volumize the face, and they both have their purpose. Fat is more of your own tissue that's placed, and it's more of a permanent solution. Filler tends to be a more temporary, but a lot of times it lasts a long time too.
So Sarah, let's talk about filler for just a second, because I feel like lately it's been getting a bad rap. Like people feel like it makes them look overdone.
Yes, that is something that a lot of patients are concerned about when they're in my chair. There's a lot of really good filler out there that nobody knows is filler, and that's our goal, is to make it look like you, just rejuvenated and enhanced. I think as an injector, you really have to respect facial balancing. So filler's a great option to add volume that we've lost, or if we're trying to create harmony in the face. For example, if a patient has full cheeks and full lips, but maybe a weaker chin, we can go in and add a little filler to just create facial harmony.
And so who is a great candidate for either the fat grafting and filler?
Well, most people could benefit from both, honestly. It just depends on the area. It depends on how old they are. And, to her point about filler getting a bad rap, a lot of times people are like, I can always tell when somebody had filler. No, you can't. You can only tell when people had bad filler. And so they both have their purpose. They both have really good uses, and it's individualized. But I think sometimes if somebody might be concerned or nervous about filler, then fat might be a better option.
Look at the before and afters. It looks like you got a great night's sleep, right?
Yeah, a lot of times we use it under the eyes, around the eyes. This one just had some fat grafting. I don't know if you can see that hollowing in the above picture, and then below we've just added some fat to just fill that in. She's a young patient, she just naturally has some loss.
Well, and Dr. T, you did that for me years ago, and we used filler right under because I was hollow right under my eye.
Yeah, and again, they're both good options. It just depends on the individual circumstances.
And your DNA potentially. And I'm not familiar with fat grafting and how long it lasts, so that might be an option. Like, how does that even work?
Yeah, a graft means you're moving tissue from one spot to another, and then your body will establish a blood supply to it, and then it's permanent. That's the beauty of fat grafting.
Where are you taking it from, typically?
Usually the thigh or the abdomen are the two places we usually gather that from.
And the downtime is minimal?
It's minimal, but it's more than filler. Filler typically doesn't bruise. Fat grafting typically does bruise for a week or two.
Sarah, here's the bottom line. You need to go in and get a consultation.
Yes, so everyone's baseline is different and their concerns are different. So I think meeting with a professional and having a consultation, I always will pull up my patient's photo and we'll look at their face from different angles, because when we're looking in the mirror, we're only looking straight on, and from other angles we could see potential areas that maybe need a little volume, that you've lost some volume, or enhanced volume that you've never had, like lips or cheeks or whatever.
Yeah, at the very least, have a consultation and all that information on your screen. Something exciting always at Utah Facial Plastics. And that free surgical consultation, that's happening July 24th and $100 off.
It's that great deal. So now's the time to call and go get checked. Utah Facial Plastics in Layton and also in Draper. We love it when you two are on the show.
Thank you for having us.
And I'm seeing you next month, not for the under eye, but the above eye. Can't wait to talk about that. And our thanks to Utah Facial Plastics for this sponsored segment. We're back in a moment.